Hey, Nicole.
What up, Jazz?
Welcome back to OT Between the Sheets. It's our third episode.
Let's go.
How are you feeling today?
Good. Tired, but good.
Okay, that's all right. So today we're coming to you guys with a quick, short episode, but this one's just to answer some questions that many people have asked, and we are going to dive into what is the pelvic floor. I know we've said Nicole is an occupational therapist for the pelvic floor, amongst other parts of the body, but the pelvic floor has been asked many times. So my question right now is, Nicole, when we reference the pelvic floor, as a female, some of the older adults may experience this when they go to sneeze and be like, "Hachoo," and it, dribbles out the other side. Is that part of the pelvic floor?
Yes. That is one small function of what the pelvic floor muscles do, yes. And it is not just for vulva owners, it's also for penis owners. Pelvic floor therapy can benefit you too. So if we have any penis owners in the audience and you are having some functional issues, make sure you
so like erectile dysfunction.
Exactly.
Oh.
Yep.
So when we're talking about pelvic floor rehab, what is there to expect when expecting your first pelvic floor rehab appointment?
Okay. There's a lot. Evaluation. Okay. So there's a lot that goes into the training of a pelvic floor therapist, or at least there should be. I'm only going to speak from my experience as a pelvic floor therapist because I have only been doing it for 3 years. So when we're talking about pelvic floor rehab, what we're talking about is specifically looking at the muscles that help to stabilize your core. It helps to allow your body to release pooping, peeing, the ability to have sex, and just overall making sure that the rest of your body functions properly. A lot of times people don't realize when they are coming to pelvic floor therapy that we're not just looking at, why is it that when you sneeze, you piss yourself, Or we're not looking at, if you're having sex and you're trying to get it in and you literally can't get it in. We're also looking at what is your core function? What is your breathing function? What is your back muscles doing? How are all of those things supporting yourself in being able to do your OT word activities of daily living? So when you are coming to me for your first pelvic floor rehab evaluation, first things first you should expect is open and honest communication. When you come in, I'm greeting you with a smile. I'm saying, hey, how's it going? I'm probably going to ask you about the weather. Something that's very basic that's like, I already know that you're coming in nervous as hell.
Why are you asking about the weather? You know what it's like out there?
Because they be keeping us in the walls. I don't know.
You probably one of them therapists that's just be talking and talking.
Yup.
Oh my God.
Yup. Exactly. Because listen, if I keep talking, then you get to know me as a person. And when you know me as a person, it's a lot easier when I'm like, so when you getting it in, is it painful? Can you have orgasms? Do they hurt when you do have orgasms? When you are coughing, sneezing, or laughing, do you have a little bit of dribble or you have a full loss of bladder? Like, those are some personal questions that people are asking.
Right. Okay, I understand. So you want to break the ice.
So I'm breaking the ice. Exactly. So when you come back, I'm going to sit you down. I'm going to ask you if you have ever had pelvic floor therapy before. 9 times out of 10, you will tell me no. And I'll say, great. I love newbies. And I do. And the reason why I do is because if I am the first person that you are seeing in terms of having pelvic floor therapy, then I don't have to worry about trying to break whatever problems you potentially had with another therapist or trying to overcome whatever issues that couldn't be addressed before. And now not only am I getting judged as a therapist for you, but I'm also getting judged as being compared to what you've had before. So I very much love newbies.
I mean, no one likes to work over somebody else's work.
Right, exactly. My tattoo artists out there, y'all be like, here we go. Okay, so sometimes depending on, who the other therapist was, and I'm not knocking no other therapist, I'm just saying every therapist is going to have different styles. So from my standpoint, when you come in, I'm going to ask you, is this your first time? And then I'm going to go over, what is pelvic floor therapy? So we're looking at 3 things.
What are those 3 things?
Number 1, we're looking at toileting, your ability to pee and poop making sure you can hold it in when you need to hold it in, making sure you can empty when you need to empty. The second one we're looking at, is sex. Can you engage in sex? Is it pleasurable? Is it painful? Are you able to have orgasms? If not, what is stopping you from having those orgasms? Is it muscular? Is it mental? We're going through those types of things. And then the third thing I'm looking at is what we call intra-abdominal pressure system management, which is really just a fancy word for making sure that your abs, your low back, and your pelvic floor are all working in tandem with each other.
Okay. So a lot of different components to keep an eye on.
Exactly. So if you're someone who is either on your feet a lot or sitting down a lot, or you're someone who has had a baby, wants to have a baby, or is currently pregnant, if you've had any type of abdominal surgery, a lot of these things are going to affect how your pelvic floor functions. And if that's the case, then you're likely coming to see me.
Okay, so besides keeping an eye out on those things, what are some other signs and symptoms of pelvic floor dysfunction?
There are a couple things. There's abdominal pain if you're coming in with a lot of abdominal pain. If you are someone who strains a lot, if you find it painful to sit down on different surfaces, whether it's the kitchen chair, the couch, the floor, kind of those type of body movements, and you've already ruled out that, okay, it's not some type of hip issue, like orthopedic issue. You didn't break any bones. You don't have any strained muscles that have been found. So then we start looking a little bit more internally. Some other signs and symptoms can be when you go to sit down on the toilets, you find it takes you a minute to start peeing and then you start peeing. Or if your pee stream stops and starts, are you going to the bathroom every 30 minutes? Or are you going to the bathroom every, 4 to 6 hours? You're holding it. Yes, my nurses, my teachers, I'm talking to y'all. I've had several of y'all on my caseload who want to sit there and you go to the bathroom 3 times before you leave the house and then you don't go again until you get home. A problem.
Okay.
Some other issues would be when it comes to having sex, difficulty getting aroused, where you want to be in the mood, but you can't seem to get in the mood, or difficulty being able to get anything past your vaginal opening. And it's painful, where you're feeling muscle spasms, or you're feeling like you're hitting a wall. Your partner's telling you, you just can't kind of break a barrier, those types of things.
Have you ever heard of inverted vaginal canal? Could that cause pain when having sex?
You mean like a tilted uterus?
Uterus, yeah. That's what
Yeah. Yeah, I've had a couple people that have had tilted uteruses. That doesn't necessarily cause pain. It can cause, from my understanding, it can cause the way that you're having sex or the way that you are, if you're trying to get pregnant, can be difficult, or it can be a little bit more challenging. I would also say it could potentially lead to some increased tension in your pelvic floor, but it wouldn't be one of those things where, if you have this, then you definitely have this.
Okay.
Yeah, because there are several people, that can have a tilted uterus and it not cause them very many issues. So.
Okay, so that's for my tilted uterus people out there.
Mm-hmm.
So who would benefit from coming and getting pelvic floor rehab?
Any and everyone, literally. If it seems to be that it is primarily for women's health, for anyone with a vulva or vaginal canal, but that's not the case. People who are penis owners can also come in.
So you're saying men don't be scared to come and talk to Nicole about your experiences that you're having.
Right. So if you are someone who has erectile dysfunction, or you're having difficulty being able to keep an erection, if you're having difficulty having orgasms, those are things that we can address. If you're having pain with orgasms, having pain when you're peeing, pain with bowel movements, we can also address those things as well.
Okay.
Mm-hmm.
So everybody can come and talk to Nicole.
Yeah. My constipation people, if you're having issues with passing stool or passing gas, or you're constantly rushing to get to the bathroom,
is that the same as when you're drinking and you can't hold your bladder, or if someone says I broke the seal and now I'm going every 5 seconds, me being the guilty party over here.
Yes. So essentially, alcohol is considered a bladder irritant, just like soda, high sugar content drinks like tea, coffee, all of those things, alcohol, they cause your bladder essentially to spasm. And when that happens, it sends you different signals that'll say, hey, we need to go
Nicole
to the bathroom.
got 75 alarms going off over here. So I'm not editing that out. Y'all just gonna have to know that this is what I deal with. Every 5 minutes, there's a different alarm, as if she can't turn all the alarms off.
Listen, okay? Yeah, if you know me personally, you know that I be struggling with time management. I need the alarms. Anywho, yes, bladder irritant. So these are things that will basically send signals to the brain that says you have to go to the bathroom, and then your body's like, okay, we gotta go, let's go. And then you're rushing to get there. So that's like the shortened version of that. There's like, smart people ways of saying such things, clinical ways, but.
Okay. So clinically speaking, who typically is the pelvic floor practitioner?
Occupational therapists and physical therapists. Yes, if you have never heard of occupational therapists doing pelvic floor, we do exist. They do exist. Primarily, historically, it has been, more physical therapists that do it. But especially now, we have a lot of people in the field of occupational therapy that are really pushing for our presence. Toileting, sex, those are what we call ADLs, activities of daily living, parts of our human experience, how we show up in the world, how we function in the world. So if you're having any type of difficulty with those things, we are also able to provide information, provide education, provide training, provide tips and tricks, assistive devices, modifications, routine development, habits. Those are all things that are part of our framework. When you are asking for a pelvic floor specialist, it should not necessarily matter whether or not you're seeing a physical therapist or an occupational therapist. The difference, I would say, in what I've seen is that as an occupational therapist, I kind of look at the full picture of your function, what your leisure activities are like, what your social participation is like, why are these issues kind of impeding your ability to engage in your different desired activities. And then I find modifications to those while also treating the muscle that are like the problem or the tension that's happening in your pelvic floor or your like habits when you're going to the bathroom or, what positions you are in for sex to increase pelvic floor relaxation. So that's what I look at.
What's the main difference? Like if I'm going and I'm like, hey, I'm having these issues, I think I need to see a doctor or a therapist. What's the main difference between choosing an occupational therapist and a PT? Like the difference between the two?
Like I said, I look more at a multi-system approach. Some other therapists may take more of a physiological approach. Right. So looking at, okay, well, how does your hips function? Are they moving the way that they should? How strong are you in terms of like your leg strength, your back strength? How strong is your core? Are those things that I look at? Absolutely, but that's not the only thing I'm looking at. Whereas there are some therapists that do tend to look at that. Physical therapists are known to look more at from a physiological approach. Now, I also say that I know several physical therapists that could be honorary occupational therapists because they do take more of a holistic approach. Okay. So I wouldn't necessarily worry about whether or not you're seeing an OT or a PT. You want to know more about like the background of that therapist. How long have they been working in pelvic floor therapy? What is their treatment styles? Because what you want to look at when you're looking for any type of therapist is, can you vibe with that therapist? Are they someone that you can get along with? You can take their information. You trust that they have your interest at heart. Those kinds of things. So don't necessarily pay too much attention to like OT versus PT. If you want a pelvic floor therapist, get in to see one. If that is not someone that you really can connect with, consider a different therapist, in my personal opinion.
Take me, I'm Jasmine, I'm 30 years old. I'm starting to have these pelvic floor symptoms where I can't hold my bladder when I'm going to the bathroom. I'm constantly in the bathroom. I'm like, wow, I think I need to see someone to help me. What is my first steps of, how do I get to you as the occupational therapist? Do I need to go to my primary, get a referral? Like, what's the process?
You can go to your primary care physician. We
Okay,
typically would say
Step
to
one,
go.
get me a primary care physician.
Yes.
All right,
Please,
cool.
please
So
have a primary care physician.
yeah,
But
I need an adult primary care physician because mine is still the pediatric primary
my.
care doctor who probably not practicing anymore.
my.
All right, step one, get me a
Anyway,
primary care physician.
It doesn't necessarily have to be a primary care physician, though. We've gotten scripts, referrals, contact from gynecologists, urogynecologists, GI specialists. So really, depending on what system is the problem, whether it is because you're having issues with your bladder, so the urogynecologist, you want to go see them. If it is a gynecological issue, so you are, or an OBGYN, you are pregnant or you're trying to get pregnant, or you were pregnant and you've had the baby, whether it was a vaginal delivery or a C-section, you want to get in to see us. Or if you're having issues with your bowels, then that would be from the GI. So really just any of those system people, specialists, you can get a referral from to say, hey, I'm trying to see a therapist.
Okay, so then I get my referral. I come to you and I'm like, okay, Nicole, help me out. What is a typical evaluation, and then what follows after that?
Yep. So like I said, I come and greet you. I'm going to
talk about the weather.
Yeah, we talk about the weather. Only briefly. Dang. Okay. I'm going to do, first step is just trying to take a history. So I'm trying to figure out where your functional deficits are and how long you've been dealing with these issues. I'm going to do a medical screen, kind of like what the doctors do. Well, they'll ask you, like, are you taking any type of medications for this? Or any other medications in general for other illnesses, injuries, diagnoses. I need to know those types of things. How long this issue has been going on. What other avenues of treatment have you taken before coming to see pelvic floor? And then really integrating that, like, I'm trying to get to know you as a person. So, what is it that you're looking to get out of therapy? Why did you decide to seek therapy? Or was it that the doctor recommended it to you and you figured, okay, well, let's give it a shot. So that's like the first steps. Then I'm going to go through an evaluation. So in the examination, I am testing your strength. So some therapists will do an internal exam. Don't look at me like that. Yes.
Testing your strengths.
Yes.
Okay.
So I will get you on the table. I'm going to look at, are you able to squeeze the right muscles for a Kegel? We call those a pelvic floor contraction. So can you do those appropriately, or are you someone that's only squeezing your butt cheeks? Because that plays a part.
Okay.
I'm also looking at, are you able to relax all the way? After you are squeezing, can you relax and let go? When you are pushing out, we call that an excursion. Are you straining to do that? Are you incorporating multiple muscles to do that? Or can you bear down appropriately? Because that will explain to me why you might be straining so hard to have a bowel movement, why it feels like you can't empty all the way, why you might be having difficulty having sex because there might be like a barrier. And when I say barrier, for some people, they do get what we call a prolapse. So that is where your vaginal canal essentially is weakened. And so it is pushing towards the opening.
Interesting.
Mm-hmm.
I never heard of that.
Yeah. So that is a prolapse, and there's, a couple different kinds of prolapses. So, and that could be a whole session in and of itself where we can talk about prolapses. But anyway, those are the things I'm looking for. Okay. Now, when you walk into my door, is the first thing I'm going to say is strip? No.
Get on that table.
Get up there. Like I said, I'm trying to get to know you first. Okay. And then I'm going to ask for your consent. Based off of what you're telling me, this is the next step in our examination. Is this something that you're consenting to? Most of my patients have said, yes, let's do it. Let's get it over with. I'm trying to figure out what's going on. And I have had some, patients that are like, absolutely the fuck not. No problem. Okay, we're going to figure out other ways. So then I'm looking at your body mechanics, how you move. When you're bending forward, are you like really tight and tense? Are you able to do a single leg lift where you're lifting your leg up from the table and, your knee isn't bending? How are those hamstrings working? Someone that has a lot of muscle tension and difficulties with just naturally moving your body? So I'm looking at those things. I'm looking at coordination. And then the biggest thing I'm looking at is your breathing techniques. those diaphragmatic breathings. Can you breathe in through your nose and blow out through your mouth? And when you do, are you just sucking it in? Or are you actually taking the time to get that air all the way down to your belly button? And then when you blow out, that belly button is coming in towards the spine nice and slowly. Because we talk about how the diaphragm and the pelvic floor really work in tandem with each other. So if that's not right, the rest of the system is naturally going to be off.
Okay, so you're evaluating more than just the inside of the vagina and seeing why penis owners aren't getting it up.
Exactly. Right. We're evaluating a lot. Okay. We're literally taking an outside in and then back out approach. And then after we do that, I explain to you what my findings are, why I think that therapy would be beneficial to you or not, and then we develop a treatment plan. And that treatment plan can include biofeedback, it can include behavior changes, it can include habit changes, suggestions like using a squatty potty when you're on the toilet to get those knees up to help your pelvic floor relax. Yep, I suggest different types of exercises, core strengthening exercises, back strengthening exercises. First thing I'm going to work on is your stretching. You know, people are going to be like, I came to therapy to do yoga. Yes, you did. Some yoga, because I've had some yogis who come in and I'm like, all right, let's try it. Try a different method. You know?
All right, so what I'm hearing is how long is a typical evaluation? Is that like an hour evaluation and then how long do you stay in session with them? Do you stay for a couple weeks or?
Yeah, for me specifically, my evaluations are an hour and then treatment sessions are about 45 minutes. Depending on if you work for a system, like I work for a hospital system. So that's how we do it for the most part. But as a clinician, I can adjust as I need. And then if you work for yourself, you might have a different approach. So evaluations might be an hour and a half, and then treatment sessions might be an hour. It just kind of depends on, you know, the client's needs and time frame and that kind of thing. And then when it comes to the treatment sessions, how long I keep you for depends on the issues that I'm finding. And we didn't even really go over all of the things that we could be looking for. So I might keep you for 10 weeks. I might keep you for 12 weeks. I personally tend to see my patients once a week for about 10 to 12 weeks. And then, like I said, I'm looking at a lot of different things.
So after you guys get your evaluations and Nicole gets your pelvic floor correct, vulva owners or penis owners, then she's going to recommend that you come to me and I'll give you a nice personal training and we'll get your body right because that plays a part into the pelvic floor. So we want all around health from you guys. This is what we're providing, a full service
health out here, y'all. That's it.
I'm going to personally train you guys, get you in shape. Summer body's coming up. Nicole's going to make sure that pelvic floor is right. So when you guys are diving into the full summer activities, we got your back.
Yep. Exactly.
So you can have sex all summer knowing that pelvic floor is right.
Right.
And your body is snatched.
Exactly.
Thank you.
And like I said, we can have several, podcast episodes, but essentially I wanted to do the first piece of saying, what to expect when you're expecting your first pelvic floor evaluation, because I've been getting a lot more evaluations lately. And at the end of every session, I'm like, so how do you feel? And the first thing that they say is, it wasn't what I was expecting. And I'm like, okay, well, what were you expecting? I don't know what I was expecting, but it wasn't that. And this was great. And thank you so much. And I'm glad I have a new avenue or a new outlook or something to work on or something, or things like that. So.
Right. And if you're not going to Nicole, but you can still expect, if you go to a different OT, they should talk about the weather before throwing you on a table.
Wow. Why are you on my case about the weather? All right.
Because we
know
what the weather is
way alone of trying to get
they
these
should
people
not
right.
Just have you jump on that cold metal table. They should at least warm you up.
Now, I will give you a little caveat as we wrap things up here. There are some therapists that will not do internal exams at all. I personally don't feel like that is helpful, because unless it is the patient's, like the reasoning behind it is either it's not clinically indicated or the patient is saying they are not comfortable with it, then I can understand why you're not doing an internal exam. But otherwise, if they are comfortable with it and it's clinically indicated, I am going to ask to do an internal exam. But there are some therapists out there that do not. There's nothing necessarily wrong with that as long as you are getting the care you need and things are working appropriately and working better for you.
I mean, this was a very helpful short episode just so people can get some of their questions out about like surrounding what type of OT Nicole is and what is the pelvic floor. So when we're referencing the pelvic floor in later episodes, because the pelvic floor is very important, especially when you're expecting a little bundle of joy.
Yes.
Which is a couple episodes. We already have a few topics just surrounding pregnancy, childbirth, after childbirth, before childbirth. All episodes will mention the pelvic floor, so it's best that you know what exactly the pelvic floor is.
Yeah. And like I said, I mean, we literally just knocked the tip of it in this episode.
The tip. You put the tip in.
It's time to go. All right. It's time to go, y'all. It's time to go. Anyway.
Nicole with these play on words. Last week, thanks for coming on this journey with us. Now we only got the tip of it.
I'm a genius.
You are
I'm a word genius. Okay, y'all. But anyway, more to come because I enjoy talking about the pelvic floor and I will continue to talk about the pelvic floor. So
thank you for joining us on our third episode of OT Between the Sheets. Again, catch us next week for our fourth episode of OT Between the Sheets. Same place, same time, 8 p.m. Eastern Standard Time on all platforms.
Where we are getting comfortable with the uncomfortable.
We will see you next week. Bye.
Bye.